Hello, this is Dr. Bill Stiles. Many people have questions about hypnosis because what they see is what they see in the movies and on TV, and they see some kind of a practitioner going booga booga and what have you. And what we do in clinical hypnosis is nowhere like that. Let me tell you what it is and how it's used, and you can read along with me if you want for much of this. I'll augment the frequently asked questions on the website here. But basically, it's pretty much the same. I'm going to cover these questions. What is hypnosis? How is it used? Is hypnosis approved by the medical community? Does a hypnotherapist have special powers? How do I know if I'm hypnotized? What if I cannot be hypnotized? Is being hypnotized a sign of a weak mind? Can hypnosis freak me out? I'm scared. I'm nervous. What will happen in a hypnotherapy session? Does this mean that with one hypnotherapy session I will actually accomplish my objectives? Next question. What's the purpose and the advantages of getting reinforcement audio cassette tapes? And will I be revealing secrets that I don't want to? Will I be humiliated? What if I don't wake up? Those are all very good questions, and I've been asked that over the 30 plus years of my practice. Well, let's begin at the beginning. What is hypnosis? How is it used? Well, hypnosis is that state of mind. It's called altered awareness with a heightened suggestibility. It means this. It's like if you were reading a really good book and you got totally involved. That's the state you get in, where you're really involved. Or watching a movie or playing a video game and you're really involved. That's the state of learning. You're better able to use your imagination. And that's what we achieve. And we do it through what we call progressive relaxation. Because as you relax the muscles of your body, your mind then achieves what we call, well, actually it's an alpha state. Now, that means you just relax enough that you get this focus. And because of the focus, you're able to program your inner subconscious mind. Now, you're not going to be asleep. If you start falling asleep, I'll sort of nudge you and wake you up. I don't want you to sleep because I want you to be able to consider the ideas I give you while you're in the altered state. You see, here's what will happen. You'll be very, very relaxed. Your mind, it'll be awake and aware in that particular state I'm talking about. But you're going to be very, very open to accepting new thoughts and new feelings about the food you eat if you want to lose weight, about exercise, about hydration, about the fact that you have one body for one life, and you don't want to keep smoking. You don't want to keep destroying yourself. And if you have anxiety, panic attacks, I'm going to give you ideas and a method where you can shut all of that down. In other words, it's really a matter of releasing the super concentration powers of your own mind. Therefore, through hypnosis, you can learn to change the attitudes that you want to change. And as you change your attitudes, you'll even affect your physical well-being. Because a lot of the things we do that we need to get rid of, like being overweight or smoking or too much anxiety, being stressed out, as you change those things, you get better and better overall. Better and better every day in every way. Now, people want to know, is hypnosis approved by the medical community? Absolutely. It's been a long, long time. In 1958, the American Medical Association approved the use of hypnosis. Hypnotherapy is used by many physicians and dentists and other practitioners. I have well over 80 now. And in the last 10 years, a lot of dentists too, 80 physicians and maybe 20, 30 dentists that have sent people to me. I have another about 50 psychologists that like to use my service. Sending their patient, they have a little prescription slip saying exactly what they want me to do. Okay, it's been approved by American Medical Association and by dentists and by psychologists. Now, good question. Does a hypnotherapist have special powers? No. Wish I did. Be easier. I don't. No hypnotherapist I know has any special powers. In fact, I want you to consider this. The hypnotherapist isn't really doing something to you. He's guiding you. He's guiding you into that state of suggestibility. You're actually sort of hypnotizing yourself through the hypnotherapist's direction. And hypnosis is a very natural state. You get in it and out of it every day. You see, the hypnotherapist is just a guide. All hypnosis is self-hypnosis. Just like all aerobics are self-aerobics. You are instructed, and then it's up to you to participate for results and success. I hear this question often. Well, if you're not asleep and you don't feel weird or strange or anything like that, and it's just like focusing your mind, I got to know, how can I know if I'm hypnotized? Well, it's just a relaxed state. And sometimes there's what we call mind-body disassociation. And that means this, that as you relax down, your mind remains awake and aware. It's sort of like when you're in the chair here, and I have recliners in the clinic. When you're in the recliner and you're listening, it's like you're sort of detached. But there's no weird feeling, no strange feeling. You're not going to feel like you're drunk or anesthetized or anything like that. You're just very, very relaxed. But remember this. You're always aware enough to be listening to what I say and accepting or rejecting. Really, it's the same feeling you'd have if you were sort of daydreaming. That's a good way to think about that. Your conscious mind could even be distracted. You could hear noise here and there. I don't have an office in a completely silent environment. I'm in a building in Wexford, and there are other doctors here too. Sometimes you can hear them. But you see, even though your thoughts may wander, your unconscious or subconscious mind is open, remains receptive to the suggestions given by the hypnotherapist. What if I can't be hypnotized? Well, can you watch TV and sort of almost fall asleep? Of course. Can you daydream? Of course. Can you read a book or watch TV or play a video game, be very involved? Of course you can. Now, when you can do those things, you can be hypnotized. You're in that alpha state when you do those things. When you're hypnotized, you're just relaxed. Remember that. Your mind is awake and aware. The level that we need to reach in order to benefit from such programs as stop smoking or weight loss or reduction of stress is, again, just similar to that daydreaming. Most people think, oh, they can't be hypnotized. They think that, oh, their mind is too strong to allow somebody to do that to them. Well, the hypnotist isn't doing anything to you. If you want to control your mind to improve your life, you're going to be helping yourself. You see, once people try, they find it's very, very easy. About 95% of the people can receive benefit from hypnosis. Maybe the other 5% is just scared. So I give you an audio tape of the session. You take it home when you're by yourself and you know what's coming up and you listen to it. You'll find you can get into that altered state of awareness. Even animals can be hypnotized simply by staring at something. My puppy dog likes to have her stomach rubbed, and she goes into that state. So, 95% of the people can benefit right away. The other 5% takes a little bit more time. Don't consider yourself one of the 5% either. That's very rare. Anyone with a mental age over 6 willing to receive these benefits, well, they'll be a very easy subject. Now, does it mean that I have to have a weak mind to be hypnotized? Of course not. Again, I am not doing something to you. The opposite is true, actually. Throughout my 38-year practice, I'm finding the more intelligent and imaginative a person is, the better the subject. The majority of people who do not go into that alpha state, that hypnotic state, are those that have a mistaken notion that hypnosis might hurt them, or they're afraid, or they're distracted through their fear or their anxiety. Well, we create a nice, non-threatening environment at the hypnotherapy clinic. And you can always, even before you come into my office, you can always decide, well, I don't want to do this. That's okay. I certainly don't want someone that is unwilling. Now, before you come in, we have pre-programming here too. What we like to do is have you maybe listen to an audio tape, more often a video, DVD. And also I have some picture books I want you to go through. If you want to lose weight, we show you exactly what happens inside your body with various kinds of food. And to stop smoking, unfortunately, we got to show you the disasters of what happens to lungs and various cancers and so forth. But we don't concentrate on the negative. We just show you what could happen, and then we concentrate pretty much on the positive side of what you're going to get, the benefits. The only thing that's going to happen is your body will relax. It will enable your mind to be more open. You won't be asleep or in a deep trance or unconscious or out of control. Oh, no. If you need or want to open your eyes at any time, you'll be able to do so. So the question, can hypnosis freak me out? I'm scared. I'm nervous. That's the answer. You're just going to be relaxed, but you will always be in control. Now, what will happen in a hypnotherapy session? Well, let me just very quickly encapsulate this. Most hypnotherapy sessions last from 45 minutes to about 90 minutes. Well, sometimes you have to come in and spend 3 hours. Now, the first hour and a half is in my outer office with the pre-programming. Then you come in and see me. I may spend an hour and a half with you, but the actual hypnosis portion is going to run about 30 to 45 minutes. That's about it. Now, you'll be given suggestions about relaxation. And during the relaxed state, your mind is open and aware, and you'll be given suggestions about changing your habits, and that's what you want. Any hypnotherapist will be talking about important facts and feelings and attitudes in changing your habit. You might be asked to recall occurrences that happened earlier in your life if they affect your present. Now, another question. So this means with one session I'll accomplish my objectives? Well, actually you need repetition. Now, I'm not going to ask you to come back again. And there are a lot of hypnotists who do that. I don't know why they do that. When it's right, it's right. So what I do is I tape exactly what I tell you. Then I want you to go home and listen to the tape. You see, as with all therapies, whether it's physical therapy or mental therapy, psychotherapy, or hypnotherapy, you have to understand it's not magic. It'll be necessary for you to work with me and then have a reinforcement of the suggestions that I give you. You know, oftentimes it takes 21 exposures, and I'll be telling you to listen to the audio tape I make for you about 21 times. Oh, you can do that over a month or so. You see what's happening is you're getting hypnotized in your own home. You don't have to get in your car and drive in to see me again. It's true. One session with me is all you're going to need, because you're going to have my voice and the hypnosis on your audio tape. You know, hypnosis can greatly strengthen your motivation, but it can't force you to accomplish anything. Your part is to do the work of listening to the audio tape. Now, you may ask again, well, what is the purpose and the advantage of reinforcement audio cassette tapes? Well, any attitude change is something that must be worked on over a period of time. They're not totally necessary. Some people are very good at remembering and putting the ideas in their mind and keeping the ideas. But I recommend you listen. I recommend that you let your audio tapes be an important reinforcement. And I give you more than just the audio tape from the hypnosis session. For instance, if you were coming in to lose weight, I'd give you a tape on super fat-burning foods. These are miraculous. The more you eat, the more you lose. I'd give you a tape on creative exercise, exercising so it doesn't hurt you. I'd give you another tape entitled Tips tricks to lose weight. This is information I've got from other people that I didn't necessarily think about myself. And you know, when you come in for smoking, I'm going to give you an audio tape from other people that have quit smoking so you can hear what they went through, as well as the hypnosis tape from your session. Okay, you may ask this. Will I be revealing secrets that I don't want to? No, you're in total control, always. When you're in this state of hypnosis, you have total control over everything you say and everything you do. This is not Hollywood. It's not like what you see on your TV. Now, I've done over 3,000 stage shows in my career, and the people that come up and do those funny things, they're not asleep or they couldn't be walking around. They're under my influence, but they don't have to do anything that I tell them. Most of them, it's psychological because most of them know they're part of a hypnosis show, and they know they're expected to do these things. They go ahead and do that. So you're not going to do anything that you don't want to. You're not going to be revealing secrets. You're in total control over what you say and what you do, and the only power during a hypnotherapy session lies within your own mind. Because in hypnosis, you are in control. You have a greater awareness than when you're fully awake, and you completely retain all power of selectivity. That means any secret you have remains your own. Now, this is a good question because people do see those hypnosis sessions, maybe senior year of high school at a prom or on television, so people ask, well, am I going to be humiliated? No, not at my clinic. We have the utmost respect for you and what you want to accomplish. It's just, it's unfortunate that hypnotism has been used by stage hypnotists to indeed make some individuals look foolish. Even when I did stage hypnosis to, get enough money to go through college and all that, I never made people look foolish. See, those people who were on the stage, they volunteered to participate, and they knew that in doing so they might be acting silly and generally entertaining the audience. And people who volunteer for these shows do so with a complete knowledge of what is to come. And, during the show, they are often uninhibited, fun-loving people who realize that a hypnosis show is meant to entertain. They know what they're doing, and they elect to do so. The power of selectivity always remains, though, in the mind, to choose what you want to or don't want to do. A hypnotherapist would never put anybody in a position of harm either. You wouldn't feel humiliated at all because that's a form of harm. What I do is a guide. It's a guide that will help you find the causes of your problems and to eventually help you overcome them. Here's another good question. I've been asked this, thousands of times. What if I don't wake up? Well, first of all, you're not asleep, but that's a good question. When you're in a hypnotic state, you're in a state of receptivity and learning and good use of your imagination. You're not asleep. Now, there are some similarities between hypnosis and sleep, but those two states are very, very different, both psychologically and physically. Now, if during the hypnosis you should fall asleep, you just wake up naturally. All I have to do is say your name, clap my hands, and I could do the same thing if I walked into a room where you were sleeping at home. If during the hypnosis you fall asleep, it'll be a natural sleep. In all of recorded history, there has never been a case of any individual not awakening from a hypnosis session. So, okay, those are answers to the frequently most asked questions. But let's say you have some more. Well, okay, just call. We have folks on the phone. Sometimes I'm able to answer the phone when I'm not in my uh, hypnosis room. That's my own office. And I'll come to the phone too. But if you have any questions at all, call us 724 940 2211. 724 940 2211. And peruse all the pages on this website. Well, the ones you're interested in. Go ahead and look at the one on lose weight, and I'll have another message on there for you. Stop smoking, fears, anxiety, phobias, panic attacks. And even if you know some children that are overweight, there's one on childhood obesity. Uh, how does hypnosis work? Then there are testimonials, too. You ought to hear some of these people. It's fantastic. And I have an audio-video page where you can click and you can see people talk about being here, and you can hear people that have been here. And also there's a page that tells you all about this clinic. Then there's a page that says you can contact us, and mostly it's a telephone number. I don't want to be receiving email. When I go home at night, I don't want to have to sit down and answer the questions there. You can call the clinic. So it has my number there. But it also has a map. This is that interactive kind of map where you can put in your address, the address of the clinic, which is 119 VIP. That's very important, persons. I guess that's what they named this drive after. Yeah, you put in your address and then Hypnotherapy Clinic, 119 VIP Drive, up in Wexford here. And it'll map it out. It'll tell you every turn, every road, exactly what you have to do. And you can print that out, too. Also, when you book with us, you book an appointment, we're going to send you a map showing you exactly how to get there. Now, basically, our clinic is right off Route 79. It's easy to get here. You go up 79 and you get off the Wexford exit 73. Just look at the map and it'll show you we're right up on the hill by some TV towers, right across the street. Good. Now I look forward to either hearing from you or seeing you for an appointment.